don't know what side's better for me to stand on.
It doesn't
Shannon,
matter.
but-
I know it's kind of a weird room in that way,
It is a little weird.
but you can wherever you feel comfortable.
And I told Masaaki this, but I might talk a little loud so she can actually hear
Oh,
me.
of course, yeah. We'll try to speak up too.
So I think that's about it. I think again, Dr. Masucci and me, and then Dr. David Shannon.
Mhm.
So shall we start, or
Sure,
you,
yeah,
you
go ahead.
get file? Or?
I'm good.
Okay, thank you so much for the coming and having Jenna being defending your thesis, and so thank you, Dr. Masucci, much. Okay, Jenna. So as you expected, you going to explain your thesis. Method a little bit, background, and then basically you want to talk about your findings or results.
Mhm.
Is that good?
Yeah.
Okay, good.
All right, is everybody else ready?
Yep.
Okay. So my thesis is called The Perception of Trust Between Athletic Trainers and Music Performing Artists. As you guys know, my name is Jenna Chinburg. I'm a graduate student in the Master of Arts in Kinesiology program with emphasis in athletic training, and it's here at San Jose State University. Overview, I'm going to go over introduction, statement of the problem, statement of purpose, my research questions, a brief review of the literature, methods, and then primarily focus on results, discussion, future research suggestions, and clinical application. As an introduction, my research primarily focused on trust in medicine and how that facilitated or inhibited the patient-clinician relationship, and I chose to focus on the performing arts population because not only is it underserved, but it's also rapidly growing, so I thought that would be something to look into. And I also focused on this aspect of personalization of care because not only in previous research, but in my own research, I found that it instilled a sense of trust. The statement of the problem, it was unknown the extent of trust established between athletic trainer and performer, in addition to what influences that trust in the relationship. And there was other research done in other scopes of practice, such as nursing or psychotherapy, but that wasn't necessarily directly transferable to athletic training, so I wanted to focus on a different population instead of theirs was more on geriatrics or an athletic population, and this is a different type of athletic population, so that's how I got to that conclusion. And I also wanted to look into successful treatment interventions because if you don't know specifically what factors into that trust relationship, you're not quite sure which treatment options would be appropriate for that relationship as well. In addition to interpersonal growth, because your relationship with someone also factors into those types of issues, and so having that established trust and knowing what factors into trust was also going to help with that problem. Statement of the purpose was to determine factors that establish or diminish trust between drum corps members and their athletic trainer, and this was primarily for whether or not it facilitated into the patient-clinician relationship, but in addition to that, I wanted to create a needs analysis for performing artists because they do have different needs in their relationship with an athletic trainer. I had two research questions. The first was what factors influence trust between the performer and athletic trainer, and the second was to what extent does trust influence the relationship between drum corps members and athletic trainers. As a basic literature review, I started with just defining trust and what it actually meant, and I did align with Shannon's definition of trust that she put in her dissertation, and it was most closely aligned to the athletic training population. And then also I looked at components of trust, which many authors had various opinions on that, but some that were referenced in the literature most were benevolence, clinical competence, and having general interaction with your patients. And in addition to that, importance of trust in healthcare that was seen through many different examples and studies. And one thing I found was that they stated that trust has to be earned over time, and it's not just an assumed relationship that should happen directly as you first have a contact with a clinician. And in addition to that, they did talk about the successful treatment outcomes, also factoring into whether or not someone trusted their clinician or if they felt that they weren't as competent as someone else. The secondary part of my literature review was just defining drum corps, since it's not necessarily well known by the general population, and it's a immersive activity that's in a musical performance setting where 150 people are put onto a field, and together they make a collaborative 13 to 15 minute show, and then they compete across the country against other competitive groups for the summer. And there is a caliber of competition. One is world class and one is open class, but I did focus my thesis on the world class population because I thought this would be most applicable to what I was trying to find. Similar to a baseball schedule or even really any traditional sport, I found that their demands were also comparable with scheduling, environmental issues, mental health problems, just across the board. It was very similar in the way that they run. And in contribution to that, it also caused a high injury risk, which I saw through not only Dick was one of the main authors that I found who focused on performing arts, but just in my own clinical experience with drum corps, I've seen things from concussion to acute musculoskeletal injuries to chronic long-term conditions, and so that kind of puts that needs analysis in play and showing that drum corps is worthy of medical care just as much as a traditional athlete. Going on to my methods, I did use a semi-structured interview protocol by first piloting it to 5 individuals in the drum corps community, and I derived my questions from the patient AT trust instrument, which was created by Shannon in her dissertation, and that was a survey. I also used probing, both anticipated and spontaneous, to try to derive better answers from my participants. If I didn't feel if they made like a short answer, I tried to have them expand on that so I could get further details of what they were thinking. I used Skype as my platform because they were spread across the country. It was pretty much the only way I could get them on board. And then I used the principle of saturation to ensure that I gained enough information to do a worthy data analysis, and I followed this after Guest and his colleagues, and they said that 12 was generally a typical number that you hit for saturation, and I continued that until no new information was found. And I used theoretical sampling with my participants. I also employed grounded theory, so I allowed the research to create a theory within itself instead of starting with a designated theory, because I wanted to see what was important to the participants directly. And I also used a whole host of trustworthy techniques just to ensure that my research was valid in quotations. So I used triangulation, member checks, external auditing, which Shannon was my external auditor, connoisseurship, and negative case analyses. And I actually really liked having the negative case analyses part into my research, because it showed that although there was an overwhelming majority that enjoyed having their athletic trainers and thought they were competent and did well with their job, there was also another side of it that showed that they didn't have the best experiences with their athletic trainers, and that helps us to know what actually is important among the whole population. For the population of my study, I had inclusion criteria. They had to be a world-class drum corps member and also have had access to an athletic trainer in the past. Exclusion criteria was age out, so they were over the age of 21, no longer participating in activity. And also first-year members, because they wouldn't have had access to an athletic trainer in the previous season. Average age was 19.6 years old. Gender, I split half and half, 6 female and 6 male. Section was also distributed equally with 4 brass, 4 percussion, and 4 color guard. And the average number of athletic trainers interacted with was 2 individuals for the most part, and then average for years in the activity was 1.92 with a range of 1 to 3, but since this data collection has been taken, there's actually individuals that have gone on to their 4th and 5th seasons, so a lot of them stay in it for quite a while once they're involved. For procedures, I started with a consent form to make sure they understood the study. and answer any additional questions they may have had. I set up individual interview times as needed, and then connected via Skype. I used both audio and video recording, starting with a digital video recorder that I set aside, and also a screenshot video recording of the Skype session just to ensure that I could go back and look at facial expressions and pauses and other things that helped me to deliberate when I was doing my data analysis. I then conducted the interview in a quiet, private space, and the interviews were between 22 and 56 minutes in length with an average of 36.5 minutes. And since I received a grant for this research, it was through the National Athletic Training Association Research Foundation, I did compensate my participants with a $25 gift card of their choice after. For analysis, I had the interviews transcribed verbatim. I actually did have a transcriptionist hired with my grant money, which actually saved me a lot of time. But also I did go through all of the transcriptions afterwards to make sure clarity was met and that all the colloquial language that was in there was actually correct. I did use inductive content analysis for the majority of my paper, and I started with raw units of data, then went to codes assigning labels to specific things I saw as patterns, and then went to higher order themes and made it into general categories at the end. And this was all done through Atlas TI software. So I first started the analysis of my paper on participant instance of injury because I wanted to create that needs analysis. And as you can see, I'm sorry the blues are a little bit hard to see, but the 60% was acute injury, so that was the most commonly seen among these participants, but there was quite a bit of chronic injury and general illness as well. Average number of injuries seen with this population with my participants was 2.1, with a range of 1 to 4 in their experiences in the activity. And in the bottom part of the table, there's sample injuries as diagnosed by their athletic trainer, ranging from shin splints to hamstring strain to bronchitis and really anything. So that was how I started, just to understand what the need was. And then I delved into their perception of injury and whether or not they felt it was important to have an athletic trainer on their staff. And so I pulled this quote because I thought it was a good representation. I feel like drum corps rehearses much greater time, even more than professional sports, because it's Sunday through Saturday, daylight to dusk, nonstop work that just has inherent injuries involved with it. So I think it's hard to go through a season without something happening. You don't see that in most sports. It's almost a guarantee that your body isn't going to work for you anymore at some point. And I think that really tells a good story of how they do think that injury is present in their population, but they don't necessarily have the right access to medical professionals in the current way that it's run. And so they did say that they viewed their injuries less severe than contact sport athletes, but they did say that injuries were an inevitable part of the activity, and that was contributing to their thought that they deserve to have the same medical treatment as a traditional athlete. I then went into a definition of trust just to see if it paralleled to the focus of the trust that I saw through Shannon's trust statement. It actually did pretty well align with the wording that she used, and the one thing that they focused on was having the athletic trainer having their best interest in mind, as stated by this individual. He said that he respected their knowledge and their ability to provide accurate information to help him to the best of his ability, and knowing that they wanted what was best for him. And that was something that was seen across many individuals. And they also stated that they liked the athletic trainer assisting them towards a goal, and they felt that that was also indicative of trust, in addition to the point that I've seen through other research that success of injury treatment or injury evaluation consistently did increase their trust overall. As stated by this quote, the problem was handled very well and had such a huge impact on my ability to perform correctly. Going into my factors of trust, which is the primary source of my data analysis, I did start with the the raw data themes then went to higher order themes in a general category. I ended up with 2 general categories, 6 higher order themes, and 21 raw data codes. And my first general category is professional proficiency, which basically is whether or not the athletic trainer did their job well and how they presented themselves in a professional manner. Secondary to that, my second general category was interpersonal dynamics, and this was more how the athletic trainer facilitated the relationship with the clinician, and also how their personality traits factored into that aspect of trust. So how I set up how to describe all this to you, I wanted to go based off of the higher order themes because I think they categorized the thoughts pretty well. So starting off with professional traits, just having a sense of professionalism, so being able to uphold someone that they can go to, but they want them to be approachable but not intimidating, but also feel professional in the way that they're holding themselves. Then consistency in general was very big, so having access to the same athletic trainers throughout the whole summer, not having people switch in and out or having a long period of time where they weren't there, in addition to continuity of care. So every single time they went to the athletic trainer, they felt that their injury was taken care of well. In addition to that, they felt that it was important whether the injury was less severe, like a grade 1 ankle sprain, or something like a fracture, they were treated fairly and comparably against all other participants, and that was important in their trust. Promptness, this wasn't really in relation to an athletic trainer being on time, but more timely return to play, getting them back into rehearsal, into a show in a quick manner, because unfortunately in this activity, you cannot withstand an injury and be out for a long period of time or else you'll get sent home. And in addition to that, confidentiality, though not as important as maybe some other populations, they did mention that they wanted their information to be kept confidential in certain circumstances. Moving to availability, this was the most prominent theme that I found among all participants. They stated that just simply having someone there on the sidelines in case something were to happen was huge for them. And this individual talked about how the staffing was a little bit unfortunate because they feel that with having 150 plus drum corps members, it's hard to just have 2 people to go to. And so they were appreciative of the fact of having an athletic trainer, but they also felt as though they needed more to adequately supply for the entire drum corps. Half of the participants had access to an athletic trainer all the time, which meant every single day of the summer. Some of them had access only half of the summer, and then others were there multiple years, and one year they had no medical staff at all, and another year they had access all the time. So it was kind of a split among all participants. And they also alluded this into proper medical supplies. They didn't blame the athletic trainers for this, but they said the athletic trainers could only be as successful as the tools that they're given. And they even referenced it as being a traveling circus, because how much can you actually stock? When you're traveling every single day, you don't have a room to keep all your facilities. So they're aware of that, but also said that having the right medical supplies would also help them feel as though they're being taken care of appropriately. Next is credibility, and this was something that they discussed a lot with me. Clinical competence was something that was extremely important to them, not only in their articulation of their knowledge, the athletic trainer to patient, but also using their medical expertise in order to provide quality care for all participants. They also liked having a plan of action, so daily having some kind of goal or something to work towards so they could actually get back into rehearsal as quickly as possible. Again, personalization of care, so they wanted not just cookie cutter rehab or evaluation, they wanted the athletic trainer to focus directly on them in their certain circumstance. Reputation was also interesting for me. That did hold quite a bit of weight for this population, and I think it does directly correlate to being in this setting for all the time, 24/7 around the same people. And so if one individual didn't have a good experience, that kind of translated to other members and participants in the study because they felt like they trusted their peers, and that directly reflected on the reputation of the athletic trainer. They also, although not required, they liked having a knowledge of drum corps or a musical background from the athletic trainer because it helped them to understand their situations and kind of the unique situations that they're put in with the activity. This goes to my next general category, so switching over to interpersonal dynamics, starting with just general personality traits. Comfort was the one that they felt was most important, and this kind of related back to having a shift in control, so giving the athletic trainer control of the situation and trusting that they will be able to handle it in the most appropriate manner. They liked the athletic trainer to be easygoing and someone, again, who was approachable. Next was altruism, so having a selfless concern for others, the athletic trainer standing up for them in certain circumstances and not backing down based on administration or other instructional staff members telling them that they didn't agree. Next was empathy. Interestingly enough for me, I saw this as a dominant trait that was important in male participants. Most of the female participants didn't even mention empathy, but the ones that did say it was something that helped them was that they liked having someone to sympathize with their situation and give them kind of a course of action of what they might be able to do to alleviate the situation at hand. They also, all of these things kind of fell into how they had a personal connection with the athletic trainer. They felt that kind of having a better one-on-one connection made it so that trust was built over time. And this person said, trust is when you can put your whole self into someone else and they're reliable. It's a big protective shell that connects you to another human being. Shannon, you doing okay with hearing me?
Yep, you're great.
Perfect. Next was the factor of advocacy, and this was kind of twofold. One being dependability, and this was somewhat surprising that it was not just earned but also forced in some participants because they only had access to one or two athletic trainers and absolutely no contact with any other medical professionals, even if they wanted to, just because of how the activity is run. And so some individuals said, well, even if I don't trust my athletic trainer, I have to depend on them because they're the ones who are most knowledgeable in taking care of injuries. But the ones that felt as though it was earned over time, one of the participants said, if there's trust built around anything, it's through the preservation of your own body. So I think that having someone that you can depend on for medical reasons, you can depend on most reasons. And that was the majority of participants kind of swayed towards that direction. Next was fidelity, so having faithfulness in their athletic trainer through support and loyalty, feeling as though they were there for them no matter whatever happened. And I found that this was something they felt was really facilitating that patient-clinician relationship. And finally, just interaction. So it goes between communication and collaboration. And communication was interpersonal, so one-on-one interaction, how they were effectively able to communicate between the drum corps member and the athletic trainer, but also on behalf of the participant when they weren't injured, was the athletic trainer able to explain the situation at hand and the severity of it to instructional staff, captain heads, and administrative staff. They also did mention collaboration in the terms of they liked working with their athletic trainer in a team setting, so feeling like they were in charge of their medical care, but doing it in a way that, yes, the athletic trainer is the expert, but they also wanted their feelings and concerns met in that relationship. As for conclusions, I agree with Shannon in her dissertation that she stated that trust is difficult to find, and I did find that within my study as well. It is truly a concept and an aspect in any relationship that is extremely difficult to define. However, I think with the factors I found that it is now better understood in drum corps and what really helped these participants in whether or not they found trust. I also think through all of these factors that trust is present in the drum corps athletic trainer relationship, and although many factors develop throughout this relationship, priority of those really depends on the individual and what they personally think is important in their mind. I also found that ideally for most participants, they wanted to have an equal balance of professional and personal traits, and it didn't have to be the same exact ones for each individual, but having qualities in each category was important for them. And it was also very clear that most of them felt that athletic trainers were fit to serve this population based on our educational background, clinical experiences, and just general, attributes that we have in the profession. For recommendations for further research, I actually have discussed this with Shannon in the past about validating the patient AT trust instrument in drum corps, because now that we have these factors, we can understand in general what the population is seeing as important, but it would be nice to use a survey type technique to see across maybe just one specific drum corps, what are they feeling is important. And I think it's also important to say that I think this should be replicated among other performing arts organizations such as ballet or theater or even just other musical organizations, because I couldn't translate other people's research to the profession of athletic training. I think I can't translate just drum corps to any other performing art because they really operate in very various ways. So. And for clinical application, I think athletic trainers in general, although we focus a lot on our physical abilities and what we can actually do with our knowledge, I think it's also important to think about how are we interacting with people and how trust actually is important in that patient-clinician relationship. And specifically, I think drum corps athletic trainers, since it's rising, there's 9 drum corps out of the 22 currently that have athletic trainers, and that's something that's building. I think it would be great to evaluate their current situation with these factors of trust and how can we use that to create a better medical staff and medical relationship with these participants. And then this also gives insight on needs analysis for both Drum Corps International and the Marching Music Health and Wellness Program. Those are both entities within this kind of drum corps, but also musical arts activity. And not only are we seeing that these drum corps members are seeing injuries through epidemiology of just getting statistics on their injuries, but also their perception of injury and wanting someone there to take care of their medical care, in addition to just having this knowledge now that there are factors that either help or don't help with that relationship. And it is seen that there is a deficit in medical staffing and medical budgeting and differences in supplies. So I think kind of standardizing that would be really helpful for this activity. Questions?
I just need a 2-minute timeout.
Okay.
I just got to handle something real quick.
Okay.
Time out.
Okay.
But I think it's great.
Dr. Masucci had to go take care of something really quick for a minute.
Okay.